पॉर्स फ्लैसिडा में अगर परफोरेशन हुआ तो उसको एटिक परफोरेशन बोलते, सेंट्रल नहीं बोलते. अरे ये तो ant also will know this. So there is no big deal at all. Perforation is caused by, especially after except वाले क्वेश्चन बोले तो you can be comfortable. Why बोले तो, that means examiner himself is saying 3 of them are options are correct. Only one option is wrong. For that he has to pick up 4 sentences on that topic and purposefully create, if it happens, he has to write it as it does not happen. Suppose if it is written characteristically it does not happen in the Harrison, he has to write characteristically it happens. So, but it is evident for you, before you only. Right? So, except based questions are very easy. Just to catch where is the evidently looking at you sentence. Saying that I am here, please choose me, it is asking you. Still like a blind a mongerer, if you are looking for all 4 are looking same to me, like Mayasabha and Duryodhan. What is this? All the 4 are laughing at me. If you feel like that in exam hall means you missed the game. So pars flaccida is somewhere towards etic, and that is the attic perforation. It's called dangerous perforation, which is a glycogen storage disorder. देखो, examiner knows that which enzyme is deficient and which disorder, वो भी पढ़ने का आपको टेंशन है बोल के, which is mucopolysaccharidosis, which is glycogen storage disorder, जरा separate करो, ये दो टेबला को बोल के बोल रहे हैं. तो at least if you know Tariq Har Anderson, he is not even asking Anderson, is it myophosphorylase? That also he is not asking. So where is the tension? Who said this is a tough paper? Give me a break. So keys. Mild form is key, doctor, always mucopolysaccharidosis. Worst form is Hurler. It's a spectrum fundamentally. The mucopolysaccharidosis is what need to be remembered. Tension pneumothorax में क्या हो जाता है? Contralateral side mediastinum get pushed. But on the side where tension pneumothorax is there, if there is a consolidation, it will have a pulling effect. And the pneumothorax has got a pushing effect. They both balance and mediastinal shift doesn't occur. That is what you need to basically remember. Case fatality rate is virulence, indicator of virulence. Then a clean, contaminated, clean, all the table, you are supposed to go knowing that, no doctor. And if you answered not sure about answering the correct answer as colorectal surgery as a clean contaminated wound, what is clean contaminated versus contaminated difference? Operative wounds in the respiratory, alimentary, genital or uninfected urinary tracts are where are electively entered. Then you call clean or contaminated. अगर सर्जन चाकू डाले तो वो हो जाता है क्लीन कंटामिनेटेड. अगर दुश्मन चाकू डाले तो वो हो जाता है कंटामिनेटेड. दुश्मन के जैसे सर्जन चाकू डाले तो. That's the reason surgical asepsis and maintaining of surgical asepsis is an art. Then, how do you know that there is an organic etiology for a given psychiatric symptoms? Orientation should not be affected. But auditory hallucination, loosening of association, personality changes, they are all the signs of organic etiology. Organic mental disorders is one of the top 10 topics in psychiatry, doctor. Definitely one question, schizophrenia, depression, mania, antipsychotic drugs like that, if you take the descending order. Organic mental disorders, personality disorders, they are all the favorite topics of examiner. P53, where does it go and affect? It will typically go and affect the G1 S phase. From the G1 to S, wherever it is going, P53 is the one which is the main regulator. If it is abnormal, it leads to Life-Romney syndrome with multiple malignancies happening is what need to be remembered. Primary case of chickenpox has happened. 12 children are susceptible. Examiner only is giving 4 adults, they are called immune. वो भी clue दे रहे हैं आपको. Secondary attack rate calculation में you have to look for susceptible cases, and you should never include primary case either in numerator or in denominator. So kitne hai susceptible? 12 children, but already one is a primary case. So kitne hai? 11 children, and out of that how many got within one incubation period? 9 children. So that is the reason what will be the answer? Typically 9 by 11, which is 0.82%. Okay, and those 2 children who got later on after 3 weeks, they are not considered because it is only one incubation period where it is being considered in the definition. Come on doctor. Amyloidosis हमारे 100 pages notebook का टेबल में एक अच्छा टेबल में लगा के आप you have to mug it ना, हाँ. So from that mugging list take out beta 2 microglobulin is dialysis. Then cardiovascular effect of natriuretic peptide. Natriuretic peptide uses cyclic GMP as a secondary messenger. Everyone knows this. If you didn't know that, you are the only one who didn't know that. One question definitely on secondary messengers in physiology. Abrasion collar is for direction of the bullet. अगर सीधा आके बुलेट लग गए तो एब्रेशन कॉलर सिंपली सटलर रहता, but with some slant if the bullet came and hit, then the abrasion collar will have a little comet like tail. So that's how looking at abrasion collar you must know the direction of the bullet. Which bias? Because the different admission rate to the hospital with different diseases. Parkinsonian bias, right? So for example, if you go to cancer hospital, out of the 100 people in the OP, 95 people have cancer only. But you can't say that entire Hyderabad, 95 out of 100 have cancer. Just because you have more cancer people coming because you are a cancer hospital. Such a bias is called Parkinsonian bias, is what need to be basically remembered. Multiple hypopigmented patches is typically post-Kala-Azar dermal leishmaniasis, is what need to be remembered. Dawson fingers, where do you see doctor? Typically in the corpus callosal area you find a typical callosal obesities only if there is a demyelination, which occur in multiple sclerosis are called Dawson. Many times we had this question in our mock test. Copper T, within how many days you can be able to insert? So emergency contraception is a favorite topic, high yield topic in gynos. So you should without mistake straight go and label 5. Don't say that I guessed between 5, 9, 7. I had a lot of struggle. Ultimately I have boiled down on 7 because 7 is Sapta Maharshis. I thought that's a good number. Saptami is a good day. So I ended up in 7. Oh, you should not say at the end of exam. Right? 5 days. 5 days is the time until which you can insert a copper T. Right? 28-year-old who suffers from bipolar disorder had lithium. Suppose if he is not responding, then what is the next drug which will be effective? Second line drug is lamotrigine. So lithium, divalproex, lamotrigine, atypical antipsychotics, any of them can be used. If the lithium doesn't, then lamotrigine can be used as a second line. So one question on bipolar depression, top 10 topics in psychiatry. 10 topics के लिए 5 hours I want your psychiatric presence with me, right? So you should not do this question wrong. How is retinitis pigmentosa transmitted? Digenic inheritance. What is the meaning of digenic inheritance? 2 chromosomes are there. There are 2 alleles, right? For a phenotypic abnormality to become visible, unless the 2 genes are affected, then only there is a development of abnormal phenotype. Such a type of inheritance decided by 2 alleles of a gene is called as diallelic digenic inheritance pattern, which is typical of retinitis pigmentosa. Most of the other conditions commonly क्या होता, 1 allele affected also you will get the disease. But here unless the 2 genes are affected you don't get. that is retinitis pigmentosa. Which drug is used for inflammatory bowel disease? You use all of them, but not dronabinol. Dronabinol is an antiemetic, right? So you use budesonide, azathioprine, adalimumab. All of them are anti-inflammatory, right? Then resection of ileum, what does it basically lead to? Anemia is because of folate deficiency, not iron absorption. Even ant knows this, right? Because iron is absorbed at which level, doctor? Duodenum, not at ileum. Human herpes virus 3 is basically varicella zoster. Then which depends on prevalence? Actually both positive, negative, both of them are dependent on prevalence. Answer can be A and also even D. So, bade exam में भी छोटे mistakes हो सकता. So, if you look at the formula, predictive value versus prevalence, if you take the PPV and NPV versus prevalence अगर आप देखें तो, अगर prevalence बढ़ रहे तो, what happens to NPV, negative predictive value? Accuracy will come down and positive predictive accuracy will increase as the prevalence keep increasing, because there is a formula for PPV, NPV that connects it with specificity, sensitivity and prevalence. I told you many times, this is one formula based on which examiner is going to ask questions in all our mock tests. At least now you remember. Once more, he will give an exam hall sensitivity, specificity, prevalence and ask you to calculate PPV. If you are looking into sky, where is TP, where is FP, where is TN, where is FN, वो सब नहीं मिलेगा, right? Unless you know this formula. Then micro to macro albuminuria. Basically giving acinibutars prevent onset of microalbuminuria. It doesn't have much effect in preventing progression from micro to macro. Macro means end stage renal disease. That is the effect which is there with the non-dihydropyridine calcium channel blockers, but not for ACE inhibitors, is what you need to basically remember. ACE inhibitors are mainly for preventing the microalbuminuria. Then which serotonergic drug should be discontinued to prevent serotonin syndrome whenever you are combining with MAVO-I, MAVO inhibitor? Yeah. Rathod is asking a question. What about diaphragmatic palsy in tension pneumothorax? Diaphragmatic palsy lead to what? Paradoxical breathing, etc. It won't have a pulling effect. But consolidation, fibrosis, they will have a pulling effect. Pneumothorax will have a pushing effect. They both will balance with each other. That is the idea. Dr. House is saying, sir, is not pyrazinamide answer for thrombocytopenia. There will be a temptation to answer that, but that is not the answer. Then, is it not atrial natriuretic peptide with cyclic GMP, sir? Yes, but that does not prevent brain natriuretic peptide from having cyclic GMP. Exam hall में, because ANP cyclic GMP, BNP should not be cyclic GMP बोल के कुछ लिखा है क्या? See, exam hall में क्या होता है कि if one fact is true, we try to use the true fact to tell that the other fact is false. Right? So, if Geeta loves Prem, does not mean Sita should hate Prem. Right? So, so that negative logic you should not run into. If you know the fact simply that BNP, ANP both of them lead to cyclic GMP, exam में guess मारने का क्या जरूरत है? नहीं है. अगर guess मार रहे हैं आप spinal cord level questions के ऊपर भी, oh, that's a low back pain. Because of that, severe low back pain. Spinal cord level में आंसर करने वाले चीजों में भी अगर आप guess मार रहे हैं, then That's wrong. Right. Yeah. Okay. If fluoxetine is there in the options, fluoxetine is the answer. We told now SSRIs may, every exam you go, they will give one question on fluoxetine. What are the side effects of fluoxetine, etc., etc. Huh? Bonnie's test is for what? One question on urge incontinence versus stress incontinence, and different types of fistulas are there, no? Vesaicovaginal fistula, rectovaginal fistula, urethrovaginal fistula. How do you differentiate? Based on the 3 swab test. That was also very recently asked question. Very high yield topic, these two. VVF and incontinence. Gar jate hi padna. Stress incontinence. What is stress incontinence fundamentally? You have got a bladder neck. Give me the board, please. So if you take a lateral view, doctor, you are having a bladder which is descending down to form a urethra through which the urine will pass. This uretrovesical angle, if it is maintained, that prevents incontinence. Those who are very elderly with a ligamental laxity, etc., they lose this uretrovesical angle. So whenever they cough, when the grandma coughs, then what will happen? She produced 10 children, right? All uncle, chacha, chachi, mosi, sab paida hua. So there is a ligamental laxity for the grandma. So because of that, uretrovesical angle is gone. So bladder is in straight continuity with urethra. Any amount of abdominal pressure will lead to leakage of urine. How will you prove that? You will do a pervaginal examination and you push with your finger, you will push this up and create a uretrovesical angle. Now you ask her to cough. If the urine is not leaking out, means the problem is a uretrovesical angle, which is basically called Bonnie's test, is what you have to basically remember. What is the key vectorial factor that decides the transmission, doctor? If a mosquito bites you, drinks your blood, you have malaria, for example. Before biting other person, if it dies, transmission doesn't occur. So what is the span of the life of the vector? Is the most important deciding factor that decides the transmission of malaria. All our idea is to decrease its lifespan so that our lifespan will increase. What about A? Breeding habits. Yeah, breeding habits are also the factor. But key factor. वो की खाली SPM में मिलता है आपको, वहां में लिख के रहता. Key vectorial factor is the longevity. अगर मस्किटो का longevity ज्यादा है तो हमारा longevity कम हो जाएगा. There is an inverse relationship. Intracranial bleeds in premature infant, they occur into the germinal matrix. One of the old question that was. Leptin is in option, obesity is in the question. If you cannot recognize that two, arre doctor, green signal laga rahe aapka aur you are not starting the vehicle. Right? Favorite question. Once more, types of Gerlins. What is the pathophysiology of obesity? Obesity physiology is a fundamental question in the exam. Leptins and Gerlins. Huh? Dawson's fingers. Once more, examiner asked the same question. Typically are seen in multiple sclerosis. Structural scoliosis versus postural scoliosis. How can you differentiate? What is postural scoliosis, structural scoliosis? Structurally problem is there in the vertebra. Postural is in the reading room, hum baith ke padke, ultimately you will become topper and recognize that you will only turn to one side, you are unable to stand straight. So that is postural scoliosis. How will you make out? Make the person to bend forward and calculate the you see whether there is any prominence on one of the sides. Suppose if there is any prominence on one of the sides, this is a functional one. But if one side is prominent than the other, that means there is a structural scoliosis. That is how you basically differentiate. 35-year-old post-transplant, CT scan shows fungal invasion of artery and there is a non-subtate mycelia. What is the causative organism? Very fundamental question. Difference between aspergillus versus mucor is a favorite topic from times immemorial. So, mucormycosis typically is a non-subtate mycelia is what you need to remember. What drugs lead to? One dyselectrolytemia question will come now, doctor. That is our deal na, before you go to exam. Causes, ECG findings, treatment of different types of dyselectrolytemias. So, hypomagnesemia, thiazides, loop diuretics, aminoglycosides, amphotericin B, cisplatin, cyclosporine, digoxin, mannitol, methotrexate. They are all the causes of hypomagnesemia. Similarly, hyperkalemia, hypokalemia, hypermagnesemia. एकदम ready होके जाना exam को. This comes under Kada equina level question, let me tell you. Right? You didn't answer means others will answer and take your seat. Be very sure. Then, what are the most suitable indications for penicillamine? Penicillamine and Wilson. We came to know about penicillamine only because Wilson was there, no? Right? So, no question of confusion. Dissociative anesthesia, ketamine. ये भी कुछ question है क्या? So that's how doctor 100 questions आराम से, हाँ? हंसते हुए, खेलते हुए, लिख के आना. Remaining questions देखेंगे. But 100 में गड़बड़ नहीं करना. 100 में गड़बड़ करे तो thousands में चले जाता rank. That's the point. So the deciding factor is not that intelligent 38 questions or impossible 42 questions. It is inevitable 100 questions that you should answer it correctly. 4-year-old malnourished comes with excessive crying, irritability, fever, not taking feeds. Once more IMNCI. Examiner is obsessed about it. How to basically calculate based on the clinical signs. Which cartilage is complete ring, doctor? Cricoid cartilage is fundamentally a complete ring. Cobra head appearance, ureterocele. जमाने से पूछ रहे. The type of ultraviolet light leading to skin cancer is UVB. 70-year-old, he is progressing to aphasia, difficulty in dressing, simple calculations. What is the examiner trying to tell you? Alzheimer. Because that is the only dementia you know. He knows that. You don't know frontotemporal dementia, you don't know Lewy dementia, you don't know cortico-basal degeneration and dementia. He knows that you know only Alzheimer. And only thing you must know is, in Alzheimer there is a hippocampal atrophy. That is what you must basically make up the mind. Then doctor, 70-year-old, progressing to aphasia, blah blah blah. What are the risk factors for Alzheimer? Hyperlipidemia, hyperhomocystinemia, hypertension, etc. Any of them can lead to development of dementia, not hyperuricemia. Too much. Nobody will think hyperuricemia, gout mein dementia hota bolke. Unless you are hyper imagining in the exam hall. Another spinal cord level question. Then, which is the drug that you want to give in Alzheimer? Donepezil, Tacrine, you know very well. 45-year-old who is a chronic alcoholic, complaints of pain and erythematous patches are there, blah blah blah. And ultimately if you do MRCP, ERCP in his case, he is a case of chronic pancreatitis. Chronic pancreatitis with steatorrhea, right? So you will find a chain of lakes, that alternating constriction dilatations will give a chain of lake appearance is what you have to basically remember. So 45-year-old, once more, that pancreatitis case, what is the normal size of a thin tubular structure that is dilated here? That is I think this question should go under crazy questions. By mistake it came, only 99 questions are spinal cord. Sorry, this wrongly classified under the spinal cord question, but crazy question this is. Of course, smallest out of all, 1 to 5 mm. Only thing examiner wants you to know how many mm make 1 centimeter. And he want to have an imagination. Do you know that in kilometers will it be, or meters it will be, centimeters or millimeters? What will is the expected size of the pancreatic duct? At least if you have seen pancreas in your anatomy at least once, you will can make a guess. But it's a crazy question, let me tell you. Who will remember which mm? And padne se aata kya hai? Nahi aayega. So, what would be the most probable diagnosis? Chronic pancreatitis. Then neonate was admitted with respiratory distress with hypoxia and cystic lucencies in the left lung field. It is which diaphragmatic hernia? Diaphragmatic hernia, Morgagni's hernia is a name of diaphragmatic hernia. Do you know or not? You will get seat in COMEDK. Cardiac question. Who said exam is Morgagni is diaphragmatic hernia या knee joint hernia? वो भी कुछ क्वेश्चन है क्या? तो इसके लिए कोचिंग, ब्लीचिंग ये सब का जरूरत है क्या? आराम से पढ़ो यारो. Suddenly if you feel examiner is going to give tough paper बोल के ड्रीम आ गए तो what is tough? Morgagni hernia is diaphragmatic hernia. That is what he is going to ask. That's what he asked in COMEDK. Socho, life become easy. And if your friend is blabbering too much with you, ask one crazy question. What is pancreatic duct diameter? Bata? So he will do anyway wrong. Tell. Such questions will come in COMEDK. Read properly. You tell your friend he is disappointed out. So crazy questions are for friends. Easy questions are for us. So that is the deal. Now a neonate is admitted once more. How will you diagnose? This is much cheaper question. You can give barium, you can give ultrasound, you can give both but not none. Simple. Then 40-year-old HIV seropositive, ground glass opacities, low CD4 count. ये सब बोलने के बाद भी अगर न्यूमोसिस्टिस कैर्नियन अगर दिमाग में नहीं आ रहे तो परमेश्वर के हाथ में है, उनके कृपा ज्यादा होना पड़ेगा. तो ट्राइमेथॉप्रिन सल्फामिथॉक्सोल डबल स्ट्रेंथ बैक्ट्रिन DS, डबल स्ट्रेंथ, you open the mouth and put. Then what is the stain for that? Methenamine silver stain. What is that organism? What is the type of abnormality? Type 1 respiratory failure. That means low PaO2 with increased alveolar arterial oxygen gradient because the problem is at the level of the alveolus. Right? Then 40-year-old HIV seropositive. Once more, what is the diagnosis? Pneumocystis jirovecii. 9-year-old decreased urine output, cola colored urine. Pediatrics में हम खाली एक टॉपिक पढ़े. What is that? PSGN. है ना? Pediatrics में you go 2 days to the ward also. You will find one post-abdominal glomerulonephritis baby sitting over there. Very common clinical condition. So now if you want to use an antibiotic, in this case what it should be? Obviously it should be penicillin. Even examiner is not asking what is the penicillin dosage, what is the protocol, how long it should be given. ये सब unnecessary story पढ़ते ना, वो भी घाय में वो पूरा घास खाने का जरूरत नहीं है. पेनिसिलिन बोल के मालूम है तो इन PSGN एग्जामिनर खुश. चलो आगे बढ़ो. Then immunofluorescence pattern in PSGN. So how many questions in glomerulonephritis? 2 आ गया. Definitely same thing will happen in APPG, TMPG. So you have lumpy bumpy deposits on the GBM and in the mesangium. So once more, glomerulonephritis में which are subendothelial, which are epithelial, which are intramembranous, and all immunofluorescence patterns. which is typically ribbon like pattern, linear pattern, all this funda padke jana. 40-year-old with breathlessness, bilateral uveitis, biopsy showing, there is a bilateral hilar nephropathy, uveitis, sarcoidosis must obviously come to mind. Sarcoidosis means serum angiotensin converting enzyme is elevated. Everybody knows this. Then bronchoalveolar lavage mein kya hota classically? Increased lymphocytes with increased CD4 by CD8 ratio. Then what is the diagnosis? Sarcoidosis. Still at this point also you are thinking silicosis, nobody will help you. So then 32-year-old with low grade fever. Chronic hepatitis C was made. He underwent liver biopsy. Doctor, this is utna mamuli question nahi hai. Hepatitis C may, okay, I'll come back to hepatitis C. Hepatitis C, cryoglobulinemia. Hepatitis C and cryoglobulinemia, LKG boy also knows. C for hepatitis C, C for cryoglobulinemia. Right? Tomorrow you will be teaching your kids. All other kids will learn C as cat, D as dog. You will teach them C is cryoglobulinemia, D is diphyllobothrum latum. Right? So, yeah. So, 32-year-old with low grade fever, chronic hepatitis C, he underwent liver biopsy. What is the incubation period of hepatitis C? Hepatitis B, hepatitis C, incubation period, if you don't know, no? Rank will be 10 times that of this number. Not 10, 100 times that of this number. ये कितने हफ्ते का है? 8 into 100 calculate करो. 800 will be the rank. 32-year-old truck driver, reticulonodular obesities, low CD4 count. Then diffuse vesicular eruption is there on him. Which opportunistic infection lead to vesicular lesion in a HIV positive individual, doctor? Herpes zoster. Then what is the characteristic? 32-year-old truck driver, chest X-ray shows reticulonodular infiltrate. What is the typical characteristic of this infective agent? Lower lobe reticulonodular infiltrates, no improvement with antibiotics means it is a case of TB. TB typically will be positive for Jill Nielsen. Once more, what is the rule? If TB is in the options, answer is going to be TB only, don't think anything else, right? Examiner feel insulted if you happen to choose Jimsa, Himsa or any other thing. Then 70-year-old, general weakness, backache, bone pains, ESR high, anemia is there, already multiple myeloma should come and sit in your frontal lobe. That I am the diagnosis. Then what is the metabolic abnormality? Normal alkaline phosphatase with a hypercalcemia is what you come across. Then what is that system to predict the scoring system? It is called international staging system based on the beta 2 microglobulin albumin levels. Then what is the most probable diagnosis? It is multiple myeloma. Then what is the best modality to confirm the diagnosis in the, this question. 78-year-old with a posture chest pain with asymmetrical peripheral pulses means what is your diagnosis? Intrascapular pain, asymmetrical pulses, dissection of aorta. So how will you diagnose? CT angiogram is what it will demonstrate the dissection. Then what classification you use? Both Stanford and DeBakey. Both of them you will use for aortic dissection. Right, doctor? I am very happy to see 53 online viewers today evening for the COMEDK. Also tell your friends, we will be hosting this in the youtube.com/onlinembbs. So they get an access if they didn't attend to review. And you can post your comments in the YouTube channel that help us to become popular, right? So they say, no, vote for me, my number is this, like that in to increase the TPR. So that way. So 78-year-old, what is the differential diagnosis? In this case of chest pain, radiating towards back, MI and aortic dissection, they are the close differential diagnosis in this given clinical scenario. Why not? Why not A? Ruptured aortic aneurysm and ruptured aortic aneurysm can remain silent without, ruptured aortic aneurysm was also given. Differential diagnosis, doctor. Actually, they both are same diagnosis, aortic dissection and ruptured aortic. What is differential about them? Aortic dissection and ruptured aortic aneurysm, which is dissecting as the pressure is increasing, are more or less same. Not a very good question. Option A can equally be good and bad. Then patient is having pheochromocytoma, doctor, all the story says, faintness, etc. Which is what? Glomerulosa is aldosterone, fasciculata is cortisol, reticulosa is sex steroids. How will you remember in exam hall? Glomerulosa, ultimately aldosterone goes and acts on kidney, which has a glomerulus. Agreed? Fasciculata, if fasciculata overworks, you become fat. Cortisol excess will lead to Cushing's, no? You become fat. So fasciculata is cortisol. Reticulosa, R is red light area, means sex. That means sex steroid. Some stupid way to remember. Don't tell Murli Bharat must teach like this. Yeah. Then Whipple's triad, where do you see? Typically in insulinoma. ये पूरा स्टोरी का जरूरत है क्या? Directly पूछ सकते ना? Do you love me or not? Why do you say that your eyes are good? I admire your hair and all that, and ultimately propose that I want to sleep with you. So you can straight away come and ask that only, and then we can bypass all this and instead of wasting time. So Whipple's triad. Then 40-year-old, sudden onset of severe headache, fainting. Yeah, same story. Pheo. What percentage of your rule of 10? Malignant are 10%, bilateral are 10%, right? Then 35-year-old, long history of dysphagia, retrocardiac air fluid level is there, no fundal gas. So classically, actually that story and this के बीच में relationship कुछ भी नहीं है. So better we don't read the story if unless it is relevant to the question. Plummer-Vinson में there is no acid reflux but dysphagia, iron deficiency and post-cricoid web. Even LKG student knows that. So which sign is not seen in echinacea cardia? You see diffuse esophageal spasm in diffuse esophageal spasm. Why will you see in echinacea cardia? They both are different, no? Am I right or wrong, doctor? I used to have confusion between London and Britain. Which is the country? Is the Britain is a city and London is a country, or London is a city and Britain is a country? Until I went to London and Scotland, I was not sure. Similar question. So these are the 100 question, doctor.